Assalamualaikum, my name is Dr. Zabullah from Avicenna International Medical University, and today we have a quiz of endocrinology from team A and team B, and those team who will give the maximum answer, that team will be the winner. So we further start the questions. My first question is, if a patient presents to you with a history of headache, peripheral vision loss, lactoria, and loss of libido, what will be your diagnosis? Prolactinoma. And which is the first initial investigation you will perform in the case of the prolactinoma? Serum prolactin level. And which is the best test to diagnose the prolactinoma? MRE. And any neurotransmitter which is an antagonist to the prolactin hormone? Dopamine. Dopamine agonist drugs. Name any one. What is the mechanism of increasing the prolactin hormone in pregnancy?
In pregnancy, prolactin hormone increases for the on breast. It increases for milk ejaculation.
Why? What is the mechanism?
Due to the increased production of estrogen.
Due to increased production of the estrogen. And another than the estrogen level, what is the another causes can increase the level of prolactin hormone?
In pregnancy?
No, not only in pregnancy.
Oh.
Any other feature which can increase the level of the prolactin hormone?
Yes, in hypothyroidism.
In hypothyroidism.
Due to increased release of TRH and TSH,
Okay.
it's lead to prolactinemia. And another is metoclopramide, antipsychotic drug,
Dopamine antagonist. Dopamine antagonist. And what is the excretion? From which organ the excretion of the prolactin occur?
from anterior pituitary.
Excretion, not a secretion. Kidney. From where the kidney. And from kidney failure mean that the level of the prolactin hormone will be the elevated. What is the treatment of prolactinemia?
Dopamine agonist, bromocriptine, cabergoline, somatostatin, and
Okay. Which type of the surgery will perform in the prolactinoma? Surgery. And if a patient presents to you with a history of the increased shoe size, feet size, and limb size, and this patient also have the symptoms of hyperglycemia, what will be your diagnosis?
Acromegaly.
What is the most common cause of death in a patient of the acromegaly? Cardiomyopathy. And which test will be performed? Initial, which test will be performed in a patient of the acromegaly? Insulin growth factor. Which is the best test to diagnose of the acromegaly? Test. What is the somatomedian?
It is a negative feedback of a hormone for release from antidepressant.
It is released from the anterior pituitary or somewhere else?
liver.
What is the other name of the somatomedian?
IGF-1.
Insulin growth factor 1. What is the main mechanism of the insulin growth factor 1?
Insulin like growth factor 1, it's increase muscle mass.
Okay.
It decrease it's increase lipolysis, and it increase gluconeogenesis, and it's inhibit pituitary production of growth hormone.
Growth hormone. Which type of the cancer can be seen in a patient of the acromegaly?
Colorectal
carcinoma. Which type of the hormone is analog to growth hormone? Any medication which is used to inhibit effect on the receptor of the growth hormone. Pegivosomate basically drug which inhibit the receptor activity of a growth hormone. And if a patient present to us with a history of polyuria, polydipsia, and this patient's urine is hypoosmolar in condition, and the serum is the hyperosmolar, what will be your diagnosis? Diabetes insipidus. How you will differentiate between the central diabetes insipidus and nephrogenic diabetes insipidus? Desmopressin. After giving the desmopressin, what will be the effect in the nephrogenic diabetes insipidus? It will be no change. It will no change. And if the after desmopressin the effect is changed, the serum osmolarity is the change, then what will be your diagnosis? And what is the main key marker in the SIADH? Eutrophic hyponatremia. As we know that in the SIADH, the level of the ADH is very high. Other than the ADH, which hormone will also be high in this case?
In this way,
What is the mechanism of ANP and BNP in SIADH?
act as an anti-aldosterone.
Act as anti-aldosteronism. Okay, act as anti-aldosterone. Other than that, act as anti-aldosteronism. What effect on the kidney tubules?
It will act on the efferent artery.
It will affect on the afferent arteriole, and when it will affect on the afferent arteriole, it causes the vasodilation of the constriction. Afferent.
Afferent is vasodilation and increase the GFR that way.
Okay, it increase the GFR, and after the applying of the EMP and VMP, the filtration fraction will be the higher low.
Filtration will be
Filtration fraction will be higher low.
high, sir.
High. How?
How it, sir, it constrict the efferent arterioles.
Yeah.
If efferent arteriole will be constrict, its GFR will be more.
Okay, what is the formula to check the filtration fraction? Yeah, that's why you can say that it is a higher low. 1, 2, 3.